health warning could affect children. The CDC, look at this, already reporting early increases in seasonal flu activity. Look where we are. In this map, you can see that we're in the red for high flu activity, but there are also cases of RSV out there. And new at 6, Channel 2's Laura Geller is in Washington, D.C. with the numbers.
This is the CDC's first release of data this flu season. We've been looking through the numbers. They show the season could be starting early.
Things are going to hit us a little bit harder this year and earlier.
Dr. Linda Nabha is an infectious diseases specialist at the University of Pittsburgh Medical Center. She confirms what the CDC just released. There are early increases in flu activity happening in most of the country.
People are now at meetings and conferences and weddings and such, and so the concern is certainly we're going to see an increased rate of flu.
According to the numbers, flu activity is highest and increasing the most in the southeast and south central parts of the U.S. It is lowest in the northwestern part of the country.
It's happening in places that we don't typically see an increased rise this early on, and for that raises a red flag.
Children are also at risk when it comes to another common seasonal virus, RSV. Data shows those numbers are surging. They are measured in cases by week. Check this out. Mid-October, just 2 years ago, there were 21 detections on antigen and PCR tests. The most recent data shows those numbers are now closer to 5,000 in just 1 week.
It's very scary to think about this so early on, right? We don't typically see it this early on in the season.
Turning back to the flu, experts say your best protection is still the flu shot. It's not too late to get it. The CDC reports so far more than 105 million doses of flu vaccine have been distributed. In Washington, Laura Geller, Channel 2 Action News.
Good morning. Today is Wednesday, October 19th. The year is 2022. It's a beautiful, beautiful Wednesday morning. It's cold outside, really cold. Got the heat on today. And I actually sit here drinking some coffee, so keep me kind of warm. It's beautiful outside. And the weather, I have to ring this alarm bell because over the last week, I've had so many friends, associates, and clients I know who are sick with the flu. I mean, like really, really sick. Like can't get out of bed sick, being rushed to the emergency room sick, being hospitalized sick. I'm like, damn, they got the flu? And it's like, I'm like, y'all sure it wasn't COVID? And they're like, no, they tested for COVID. They did not have COVID-19, the coronavirus. They had the flu. And the flu could be really, really bad for you, especially if you're not prepared for it. Meaning, a lot of these people got the flu in the past week or two, and it really wasn't. The weather wasn't that cold outside. A lot of people probably hadn't gotten their flu shots. I got my flu shot. Flu shot maybe 2 weeks ago, 3 weeks ago, maybe 2 weeks ago. I went and got my flu shot. You can walk into any drugstore, grocery store, any pharmacy and just say, hey, I want the flu shot, and they give it to you. And I walked in and Kroger's, and I was grocery shopping. I said, let me run my ass and get the flu shot. And when I specifically left the gym and went there to get that flu shot. And so I wanted to work out first, so I wouldn't be sore when they gave me the shot. But anyway, so many of my friends and associates are sick with the flu. Some of them so sick that a few of them are in the hospital. This is kind of, these are normally healthy people who work out, who in the gym, in great health, and all of a sudden this flu to knock their ass damn near out. One was throwing up. He couldn't stop throwing up. He was dehydrated. So they had to take him to the hospital and put him on some fluids. The flu can affect us in so many ways. Obviously, it kept him very nauseated. It caused him to have a lot of reflux, or he was throwing up and couldn't hold nothing down. Couldn't hold no soup, no water, no nothing. Everything come up. If you ever had the flu before, it ain't fun. I remember when Earl first got sick in December of 2019, they said it was the flu at first. They said tested positive for flu something, the AB something. But later on, we realized that he might have had the flu at that time, but he had coronavirus at the same time. His situation got so dire so quickly. But something caught my eye in this report that I was reading about the early aggressive flu season impacted the emergency rooms across Metro Atlanta. And this is my great concern. Georgia is now second in the nation for flu activity, according to the CDC. And they say that we have had 2 mild flu seasons, so that can make us ripe for a severe season this year. Because the last 2 years have been pretty mild because we were all wearing masks and social distancing and not really in the gyms as much and avoiding people. But this is what interesting to me. They said we found hospitalizations due to the flu were 80% higher in black adults compared to white adults. Blacks said over the last 2 years, Dr. Carla Black with the CDC said over the last 10 years, the flu has been especially hard on ethnic minorities due to less vaccine coverage, access to medical care, and underlying medical problems. And we found that hospitalizations due to the flu were 80% higher in black adults compared to white adults. 80% higher. Well, that goes back to that flu shot. That goes back to that infamous flu shot that none of y'all want to get. I get the flu shot every year. I've always gotten the flu shot. I've never had a question about. I've been getting the flu shot since I was an adult, since I was in high school. But I know a lot of my friends and associates don't want the flu shot. I'm not getting the flu shot. And because so many black Americans have fear of this flu shot, which I don't know where all this fear comes from, y'all. I have no clue. And I'm not going to sit here and even buy into all these conspiracy theories about flu shots and COVID shots and high blood pressure medicine, which I went to my doctor yesterday. But I went to my doctor yesterday because it was time for me to go. I go to the hospital doctor about 2-3 times a year. So they want to check your blood pressure, make sure the medicines are working. My blood pressure was fine. My weight was substantially down. I was at 280 early this year. That was my max, and now I'm down to I got to a low of 230. Now I'm back at about 245, 250 somewhere. I think it was 252 yesterday. So my weight has come up 20-something pounds since I'm back in the gym. However, my blood pressure was still normal, which was great. Got to keep an eye on that blood pressure, which means my medications are working, and everything's going great in that department. Now, a lot of you all, I know, because I talk to enough black folks to know, y'all don't want to take them flu shots. You damn sure almost quite a large segment didn't want to do the COVID shots, which reminds me I still got to get my COVID booster shot. We're going to work on that today. But I know a lot of y'all don't want to get them flu shots. You didn't want to get the COVID shots. A lot of y'all don't want to take blood pressure medicines. Hell, you don't even want to go to doctor's offices like I do. You're always at the doctor. You damn skippy. I'm going to take care of my fucking health. I had to make sure my blood pressure is fine and make sure there are no other health issues. I don't know. It's just weird to me. I had a friend of mine who came, one of my clients, a good friend, he came by here a few days ago, and he had the monkeypox. And the monkeypox had caused some severe abrasions on his face, so to speak. So here you can see pock marks all over his body and legs and stuff. But one of the things concerned is his right leg was swollen. His right leg was swollen, and he was having difficulty walking. There's a guy that works out a lot. He's in the gym. He's doing all this stuff. But his right leg and foot was swollen. He was having some issues. He'd been to a couple of doctors, and nobody can quite figure out what the problem was with his leg. Oh, this is just a little side note here. But this is a person who I've known for years who has a very high sex drive and has had a lot of unprotected sex in this city. Oh, here we go. Here we go now. Here we go. Your scheduled appearance. You know, it'd be so nice if you can just lay on that floor and relax a little bit. I have my little chit chat here. Anyway, as I was saying, my friend who came over here with the swollen leg, and his leg was all, he had a rash on his leg too. It was bad, y'all, like really bad. And I looked at that. Anyway, but this man has a lot of sexual contact with a lot of people all the time. He's always having sex with people, unprotected, no condoms, no nothing. And what does he think was going to happen to his health? This man was looking rough sitting here. I mean, looking rough. That monkeypox tore his ass up. Now you're sitting over here, your leg all swollen, you barely can walk, you can't work. I'm thinking, dude, y'all, you need to go back to the doctors. I went to this doctor. I said, you need to go to a doctor who specializes in whatever issues you have down that leg. And you also probably might want to make sure that you go to but some doctors that handle sexually transmitted disease. You don't know what's going on. You might want to make sure that you don't have something going on. That when I go to my doctor, they check for everything. Every time I go, they do an HIV test, a syphilis, a gonorrhea, everything. That's just how my doctor operates here in Atlanta. They check for everything. He's like, "You're gonna check for everything?" I said, "Okay," because you don't know. So if you have thousands and thousands of patients coming through your door on a daily basis, on a daily basis, it's best to have them checked for everything. Everything. So the reason why I just said that is because my friend who was sitting here, he had went to a couple to general practice. They didn't check him as thoroughly as I asked him. Did they run what tests did they run? I don't know. You don't know what kind of test they ran. You don't know what they were checking you for. They just looked at your leg and they didn't see this rash on the leg, and nobody thought, well, let's check for syphilis and gonorrhea and God knows what else might be going on down here. And we don't know, but check. Y'all got to go to these doctors. And see, this is why a lot of these women are given birth to, I know this is a little off subject, but you have a lot of women who are pregnant with gonorrhea and syphilis and HIV, and they're passing this on to their children, their babies, because they're not getting to the doctors and getting checked for everything. When you go to a doctor, they need to check for everything. The last few doctors I had, they checked. This one in particularly, I guess because he's also in the city, over in the Emory area. You walk through that door, they just start checking the list. Check. And they check for everything. They don't play. You ain't gonna get out of there. They're gonna run them labs. And they're gonna take your blood. And speaking of such, they had a new nurse in there that was taking my blood. She was trying to kill my ass over there. She had my arm. I'm used to somebody, when she walked in there and that needle looked a little big, and I'm not a nurse or nothing, so the needle looked a little bit bigger than normal. I was like, that looked like a big ass needle to be pulling some blood. But I said, okay, maybe I didn't pay no attention to it before. But I thought they normally a little small, little tube on it. I don't know. She stuck that big ass needle in my arm. Ooh, sorry about that. And I'm jumping and moving around, and she's trying to get this blood out. I said, okay, this ain't working, honey. Oh, I apologize. I'm so sorry. No, she got finished getting them a couple bites. She was supposed to put a whole bunch of blood, and she only got 3.5. Then I had to stop her ass. And then it was like, we're going to do the other arm. I said, no, you ain't doing this other arm. I said, use what you got. She said, okay, it'll be enough to use your hand. She was I was had enough of that. And I'm like, what the hell? I haven't had an experience like that with somebody pulling blood and not really knowing what they're doing and being in decades. I'm like, okay, this woman is coming. She's a very young black chick. She'll probably get it together eventually if somebody don't haul off and slap her ass, because that shit was very painful. And I was like, okay, you don't know how to pull blood. I wanted to say something, but I know they have been short-staffed over there, and I know they got some new. This is where you go get somewhere. I know that my doctor's office have been short-staffed for a little while. Now they got a bunch of young nurses in there. Oh boy, we're gonna be in trouble. But anyway, back to the subject matter. The flu shots, going to these doctor's appointments, going to see your doctor, getting your health checks. Those are all important. Of the people I've been able to speak to who have been sick with the flu, the first thing I asked is, did you get a flu shot? No, I didn't get a flu shot. I said, okay. Y'all can't be in these gyms, these nightclubs, these hookah bars, these sex parties. Y'all know y'all going to them sex parties, some of y'all. You might need one of these, the flu shot if you're going to a sex party, but you can't start with a flu shot. I don't understand how people could be around all these people and you don't go get a flu shot or your COVID shot or get daily health checks to know what's going on with your health. I just find this very odd. Why? Why? Why can't you go someplace and find something to do? Why? Why? I don't understand. Why? Okay, you just determined. He's just determined. I'm just sitting here. He's just determined. It's just ridiculous. It's like, okay, what is going on here? Why? 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 Here, I'm gonna take this toy. Here, you see this toy? Look. There you go. Go get it. Way across the room over there. Maybe it'll stay over there. I'm gonna put this ass outside for a little while because this is starting to get ridiculous. It just don't make no damn sense. It's too early for all this shit. But anyway, that CDC, and then another thing. Every time I post something about the CDC and black folks telling y'all, you niggas go haywire. The CDC is fake. They picking on black folks. They putting out false information. I know them Hispanics, Latinos, and white folks got more this than that than us. I'm like, why would they make this up? What would be the benefit? Why would the CDC lie about our STD rates, our drug use, what would be the benefit for this? They're telling you this for your own damn good so you can make some changes in your behaviors. But y'all so busy looking at them like, hey, after something, they suspicious, they doing something, they this, they that. No, they ain't doing shit. They just telling you what you niggas are up to. Doing nothing. You won't get your shots. You won't use condoms. You won't get protection. You won't go to your doctor's appointments, and you're blaming the CDC for all this shit. Give me a break. The craziest shit I ever heard. The craziest shit I ever heard. And you motherfuckers, I don't know. Sometimes it's disappointing you dealing with all these crazy black folks. And then when they get sick, can you bring me this? Can you help me with this? Can you help me with that? You should talk about that shit when you didn't get your damn flu shot. You know, you feel sorry for you. I hate for people to be sick, because I know when I get sick, it's not a good feeling. But when you're just sick and you're in the hospital, or they rushing you to the hospital and you still got bills to pay, this is what I don't get. This is why I get my flu shot. I can't afford to be laid up in Grady Hospital dealing with the flu or COVID or any other health care matter for that, or high blood pressure. I'm going to go take my blood pressure medicine, go to my doctor's appointments. I'm going to exercise and work out, which I'll be doing shortly in a minute here. In fact, this worker just canceled on my ass. I could have been in the gym right about now. If I'd known his black ass wouldn't come until later on, niggas. That's another video though. But anyway, I'm going to do everything I possibly can in my power to stay in good health, if that I can do, that I know to do. And getting those shots is essential. Getting your flu shot. I hadn't had a tetanus shot in over 10 years, and the nurse was like, when's the last time you had tetanus? I said, it's been over, at least I thought it was a little decade, shit, we're going to do that too. I was like, give it to me. You know, so I don't understand. I try to understand, y'all, why you niggas don't like to go and do this stuff, but it doesn't make sense to me because it doesn't work out in y'all favor. 80% of black adults, 80%, let me read that again because it caught my eye and I thought that was kind of, that number was high up there. Black said that the flu has been especially hard. Dr. Carla Black with the CDC said that over the last 10 years, the flu has been especially hard on ethnic minorities due to less vaccine coverage, access to Medicare, and underlying medical conditions. We found hospitalizations due to the flu were 80% higher in black adults compared to white adults. At Doherty Pharmacy, they're giving 60 to 80 vaccine shots a week, but they like to do more. We're trying to get as many people as immunized as possible for the flu shot. Y'all go get them flu shots. Go take care of your health. Stop what you were doing. Stop what you're doing. Get ready to go to the bar. On your way to the club. Got to go up to Cheesecake Factory. Go and walk around at Lenox Mall or whatever mall's in your area. Y'all black folks love to go out and do all this shit, but they don't have time to stop at a doctor's office. You ain't got time to run up to CVS and pharmacy or Walgreens or Kroger or whoever near you and run in there and say, give me a flu shot and whatever other vaccinations I might need. And those of you who have fear of this shit, listen. I don't know what to tell you, but I tell you this much. I've seen enough people. I've seen the flu just in the past few weeks take out some big dogs. The niggas was big, and they ass right on out. Right on out in the back of an ambulance, and the flu. I said, oh, Lord, they didn't have the flu. Man. No flu shots. Not taking their high blood pressure medication. Not going to the doctor. Or when they do get to the doctors find out, oh, your blood pressure is sky high. You can't even let you leave because we got to give you something to bring your pressure down. It cannot be that hard or difficult to take care of your health. I mean, it just don't make no sense to me. But hey, who am I? I'm just some fool sitting here on the internet. I'm going to get my shots. I'm going to get my vaccinations. I'm going to take my blood pressure medicine. When I was at the doctor's office, went over the checklist of everything. He renewed all my medications, sent them over there to the doctor. That was one of the reasons why I was there, because after you know, every few months, your doctor prescriptions have to be renewed. And I said, let me get in here, because I don't want to have to call the pharmacy and they can't renew it. And then I'm trying to get into that. I like to be proactive, getting to the doctor's office first. Get my prescriptions sent over to the pharmacy, and then they have all my stuff lined up there, and I can just go on in there and get my stuff. Ooh, I can get out of here. I can turn that heat down. Well, all I know is I hope that you all are listening to this and quit attacking the CDC. Some of y'all are going to end up, a lot of these kids, a lot of children are ending up sick too. The flu is very easy to pass around. And a lot of folks are going, a lot of kids are getting sick, and a lot of adults are getting sick. Like I said, most of these guys I'm dealing with, they bodybuilders, fitness trainers, all working out in the gym, but they get around a lot of people. So common sense should say, all right, I'm around a lot of people come September, I need to get my flu shot. That's what I typically do. I waited a little late this year. I think I ended up getting it in late September, early October. Normally I get it in September. I don't like to wait because I'm always in the gyms. And let's just keep it real. Gyms are known for passing a lot of germs and viruses and bacteria. And I want to make sure that I'm not getting sick, because I cannot afford to lay up in Grady Hospital dealing with the flu or COVID or any other ailment. I can't afford it. I just can't. Yes, I have health insurance. I got Aflac and I got all the other shit I pay for, but that ain't gonna help me pay these fucking bills over here. And I'm in the hospital creating even more bills to have to take care of. That ain't gonna work. I'd rather get the flu shot and every other shot that I need to get. But it's up to you all. Do what you want to do. You niggas crazy, but seriously, y'all need to really. This is gonna be a real rough year for the flu. Don't forget, we got COVID running around, so you get your COVID booster shot. Those of you, I know some of y'all ain't getting that either. Okay, whatever. Well, anyway, today is Wednesday. It is October the 19th. The year is 2022. Go get your flu shots. Go take care of your health. Get your vitamins and eat whatever you need to do. Y'all better be prepared, because it's going to be a rough flu season, and it's about to get started. It's already got started. And you don't want to be one of them people laid up in any hospital with other patients, because the hospitals are already packed right now. They are packed with people who are sick with the flu. And when they have a large group of people in these hospitals, y'all know how the treatment gets for folks who look like us. Yeah, you get pushed to the side. Just keep that in mind. You get pushed to the side. White is right. Always will be. All right, today is October 19th. The year is 2020. I'm out of here, and enjoy the rest of your day.